For a rapidly growing nation of 1.4 billion people, achieving comprehensive vaccine security is a strict prerequisite for maintaining national stability. Protecting that population requires a rigid, multi-layered architecture of immunity designed to move billions of sensitive biological doses across a continent. This system is built on an institutional triad: the NHC, the NMPA, and the China CDC. The National Health Commission acts as the primary architect, managing the National Immunization Program to dictate which vaccines are essential for the public. The National Medical Products Administration, or NMPA, serves as the regulatory sentinel. Every single batch of vaccines must pass their lot release testing before it can legally enter circulation. By separating policy decisions from safety enforcement, the state attempts to eliminate internal conflicts of interest and restore public trust in the supply. In 2019, China implemented the world's first standalone vaccine administration law, isolating these products to subject them to the most stringent supervision. Central to this law is the marketing authorization holder requirement, which forces domestic manufacturers to hold absolute legal liability for a vaccine's safety and quality throughout its entire life cycle. These legal upgrades allow China to meet international benchmarks. In 2022, the country's regulatory authority passed a rigorous independent assessment by the World Health Organization. This legal framework effectively recasts vaccine production as a matter of national security, shifting the system into a globally verified legal fortress. Once approved, a vaccine enters a dual-category market dictating its price and reach. Category 1 includes mandatory state-funded vaccines like polio and measles, provided free to all citizens. Category 2 covers optional private market vaccines like flu shots paid for out of pocket. This two-track system secures a baseline immunological defense for the entire population, while leaving advanced preventative care to the private market. Biological products are temperature-sensitive. Exposure to heat or freezing temperatures destroys their chemical potency. To manage this risk, the state utilizes commercial logistics giants to build a massive, specialized medical cold chain infrastructure. Transport is restricted to specialized vehicles, like these 4.2-meter trucks equipped with internal cameras and dual locks that require two-person authentication. A digital surveillance layer monitors the internal temperature in real time. If the thermometer fluctuates more than half a degree, it triggers an immediate alarm at the central control hub. In high-altitude regions like Tibet, teams use portable, temperature-controlled vaccine shelters to ensure the cold chain remains unbroken for the final mile. The cold chain operates as a continuous data stream, verifying the viability of every single dose from the moment it leaves the factory to the moment it reaches the patient. The local community health center is the final node where this national logistical effort meets the individual citizen. When a child is born, they are immediately entered into the electronic immunization registry system, creating a digital record that follows them throughout their education. Parents receive automated reminders on their smartphones, with a schedule calculated by the system to ensure no required shots are missed. At the clinic, a doctor scans the vaccine's barcode before the injection, instantly uploading the dose data to provincial and national servers. This digital record is a requirement for school entry, ensuring near-universal compliance with the state's immunization goals. The community clinic transforms national policy into individual protection, digitizing the health status of every family in the registry. This digitized system stands in sharp contrast to the grassroots campaigns of the 1960s, when Dr. Gu Fangzhou distributed polio vaccines disguised as sugar pills, carried to rural villages in ice-packed thermos flasks. Today, the Healthy China 2030 blueprint is shifting the system's focus from basic disease control to advanced preventative healthcare. This shift was formalized in 2025 when the state added the HPV vaccine to the free national program for 13-year-old girls, targeting the total elimination of a preventable cancer. By integrating strict legal liability, real-time logistics, and community-level tracking, China has built an architecture that treats the immunity of its citizens as a primary component of national strength.